Yeah, basically for me, anything that deals with clinic officers and then their physician assistants, I'm always there. Because these are the people that are saving our nation. These are the people that are saving lives of people. So if there's anything regarding these people, well, I get the motivation to go. That's why this prompted me to come and see, because I knew there is something good issues that are going to are going to be discussed right here, which will also bring change in the care of our patients in our respective countries. So it was worth coming this side. Thank you. I'm Solomon David Chomba. I'm a clinical officer. Initially, I had been enrolled in as a diploma holder in clinical medicine. That is in 2013. I graduated at Malawi College of Health Sciences. Thereafter, I was practicing as an obstetrics and gynecological clinical officer. So I worked at Mzuzu Central Hospital for about 6 years. Mostly I was manning the gynecology clinic, where I would do almost everything in gynecological procedures and surgeries, everything. Then thereafter, I had to go into a specialized course. So I specialized in mental health and psychiatry. And as I'm talking now, I'm practicing as a mental health and psychiatry clinical officer at Mzuzu Central Hospital, and I'm heading the mental health department at Mzuzu Central Hospital. I'm from Malawi. That's the southern part of Africa. Well, basically, Malawi clinical officers and medical assistants are the backbone of health service delivery in Malawi. Taking away these cadres is killing health service delivery in Malawi. As I'm talking, more than 90% of the health service is provided by these cadres. We have got a small population of medical officers, that is around 540 medical officers, and the rest is clinical officers and medical assistants. It's about 6,000 or so. What the situation in Malawi is, we have medical assistants. These are certificate holders. These are the Duman health centers, rural health centers and whatsoever. And then we have clinical officers. These are diploma holders. And the diploma holders, they man district hospitals and some in central hospitals. Then recently we have BSCC holders. These are specialist clinical officers. These are the people that specialize in mental health and psychiatry, like what I did myself. Some in surgery, some in internal medicine, some in pediatric and child health, and reproductive health, that is gynecology and obstetric. So these people now they've just been registered now at the Medical Council as clinical associates. So it's a new discipline that is coming for these BSc holders. So I've got several clinical officers that are now specializing in different clinical fields. Basically, the practice for us, a diploma holder is able to do anything in Malawi, can do all kinds of surgeries. As I'm talking for myself, when I was a diploma holder, I could do all kinds of surgeries, talk about hysterectomies, that all gynecological emergencies, we were able to handle everything. That's the situation now. You can go to district hospital, you find that the people that are covered in all district hospitals are clinical officers, and then the clinical officers are manning everything like that. But now with this introduction of the specialized program, at least it has made these cadres at least to have a paper on whatsoever thing they are doing. And again, it's a way of a career development for these people. That's the initiative which government has introduced to them in Malawi. For the past 2 years, there was a survey, a research study which was done in Malawi, and it proved that most of the operations, the surgeries, are done by clinical officers in Malawi, and most of them are more successful. And it was a comparative study. They were trying to compare surgeries done by medical officers and surgeries done by the clinical officers. Clinical officers outshine the medical officers. So there's a lot that these guys are doing in Malawi than these medical officers. Most of the medical officers, they do administrative work. Most in the district hospitals, they're either district health officers and the like. But when we talk of work on the ground, the people that are manning everything, making critical decisions, and even making critical care of the patients, these are the cadres. Yeah, basically the training is quite good, more especially this time. If we're to talk of, I said a medical assistant gets a 2-year training. In clinical medicine, that is certificate in clinical medicine, and it's called a medical assistant. So it's 2 years in training. Then immediately it goes to the health center to manage health center. And then we have got diploma holders. These are the clinical officers. They undergo a 3-year training and then 1 year of internship. Thereafter, they work as general practitioners, so they can touch every discipline of medicine. Then now, the other form of training which has just been recently introduced, the specialized training, whereby clinical officers, the diploma holders, they specialize in different disciplines of their choice, and again, depending on their skills and their abilities whatsoever. So that's the kind of the training which is taking place in Malawi. However, there's still some challenges in terms of furtherance of that is furtherance of the education in terms of having the master's degree whatsoever. There are some limitations which, as a union, because I'm the president of the union for the physician assistants in Malawi, we are trying to push for that, because we want at least there should be a clear career path for our cadres. When at least they should excel, they get their masters, they get their PhD. However, we have some who are doctors now, and they're PhD holders. They use different ways of acquiring that. Yeah, that's the situation in Malawi. What I would like to tell the world is, let's open up for these cadres. As I'm talking, Malawi is training a lot of these cadres, but the government is failing to employ these people. As I'm talking, there's a petition which I've just written in the government some 2 weeks ago, because we've got over 3,000 clinical officers that are trained, but they're just staying. And these are the people that have got skills, almost all kinds of skills. They're able to manage a district hospital, even central hospitals, but they're just dumped up like that. So what the message I want to bring to the world is, can they open up, allow these guys to go and work elsewhere? And it's a kind of wastage of resources. They're just staying. So if other countries in the world can open up for our cadres, that would be very good, because at the end of the day it also help to reduce unemployment rate for amongst our cadres, that is the clinical officers, the clinical associates in the Malawi. This is a very good discipline. Clinical officer is a very good discipline, because a clinical officer is somebody that knows more of hands-on work. That's the difference. More of hands-on work. These are the people that do that. So it's a very good discipline, because it's not after theory, it's after doing hands-on work, because it's hands-on that is going to save the patient. So this discipline is very, very important in the sense of saving the lives of our people. So I will encourage them to join up this field.